Hello, I'm Dr. Stephen Hotze. Welcome to Health and Wellness Solutions. Did you know that this year alone, 1.25 million Americans will have a heart attack? That's a heart attack every 25 seconds. Of those having a heart attack this year, 1/3 of these individuals, 425,000 people, will die. It's the #1 killer of both men and women. Here to tell you the connection between hypothyroidism and coronary artery disease is Dr. David Sheridan and Dr. Don Ellsworth, both from the Hotze Health and Wellness Center. Doctors, thanks so much for joining us today.
Our pleasure.
Pleasure to
Tell
be
us
here.
about this connection between coronary artery disease and hypothyroidism.
Well, this is a very important connection. In fact, it was noted that when hypothyroidism was first discovered, that at autopsy they frequently would see severe atherosclerosis, hardening of the arteries. When folks had goiters, which is an enlargement of the thyroid gland, the old treatment before they understood what was going on would be to remove the thyroid gland. Well, they would become profoundly hypothyroid, and at autopsy again, they saw severe atherosclerosis. Well, Dr. Broda Barnes began treating hypothyroidism, and he noticed something striking. He rarely saw heart attacks, cardiac deaths, in the folks that he treated with hypothyroidism. Dr. Wren followed up that research and saw a 44% reduction in hypothyroidism when he treated individuals with desiccated thyroid. Today, we now know that hypothyroidism is a major cause of coronary artery disease.
It's interesting in Dr. Broda Barnes' study of his patients, which encompassed over a 20-year time period between 1950 and 1970, he saw a 94% reduction in deaths due to heart attacks in his practice, which is remarkable.
He used the Framingham data, which was the general tendency in the country, was believed to represent the general trend in the population in the country, and his results were much better than the population in general.
And it's interesting, in hypothyroidism, we also see one of the major signs is elevated cholesterol levels. And there have been numerous studies that have been done going way back into the 1920s and 1930s, where physicians treated patients based upon their cholesterol level with desiccated thyroid hormone and routinely got dramatic lowering of the cholesterol levels down into normal ranges. So many people feel or are concerned in the conventional medical community that elevated cholesterol levels cause coronary artery disease. We know that taking desiccated thyroid hormone or even synthetic thyroid hormone both will lower cholesterol levels. This would be a whole lot cheaper, less expensive, and safer than using some of the statin drugs or other anti-cholesterol drugs that they use, don't you think?
Oh, absolutely. We know that the hypothyroid state causes a degeneration of that medial muscular layer of the blood vessel.
Right.
We know that mucin can develop at the site of this injury, we'll call it.
Which is like the plaque substance?
It's the beginning of the plaque substance, and I think it's also can also be irritating to the vessel, starting that inflammatory cascade that leads to the eventual formation of plaque. You know, we've mentioned before that atherosclerosis, the plaque in the vessel, is the result of an inflammatory process.
And interestingly enough, in hypothyroidism, patients are much more susceptible to infections. This is a classical feature in hypothyroidism. And so individuals that have recurrent and chronic infections tend to have a much higher rate of coronary artery disease because the infections are what causes the inflammation. They oftentimes attack the coronary arteries. This was seen in an old disease we don't see much anymore, but which was the leading killer and captain of death in the first half of the 20th century, which was tuberculosis. People that died of tuberculosis on autopsy had very severe coronary artery disease. And that goes right along with the findings that hypothyroidism leads to a susceptibility of infectious diseases. Well, thank you both, Dr. Sheridan and Dr. Ellsworth, for joining us today. Thank you for joining us today as well. At the Hotze Health and Wellness Center, we specialize in treating hypothyroidism and would love to answer any questions you might have in regards to treatment of hypothyroidism, preventing coronary heart disease, or other conditions. If you have any questions regarding your health, then please email us at drhotze@drhotze.com. or call to have a free consultation with one of our wellness consultants at 877-698-8698. That's 877-698-8698. Also, be sure to join our email list, and once a week, we will send you a video highlighting various topics regarding women's health issues, hypothyroidism, natural hormone replacement, and numerous other pertinent videos regarding your health. We are excited to help get you on a path of health and wellness so you enjoy a better quality of life. This is Dr. Hotze saying thank you for joining us today.